Yeah, well, I think we have to stop thinking about these things as separate. I mean, we're paid to do our clinical work, and a lot of these other things go on off the side of our desks. But because they're important and they can influence the way you practice clinically, if you value it enough, you will do it. And I'm just thinking of the people who are likely listening to this are engaged. And so they will recognize, preaching to the converted, if you like. So people are doing this because they want to be better. And I think if you want to absorb knowledge and improve the way you do things, then we almost have an ethical responsibility to give back to that and take it to the next level.
You're listening to Pediapain Pain Focus, episode number 47. And today we're talking about policy as it relates to pediatric pain. So stay tuned.
Pediapain Pain Focus.
You're listening to Pediapain Pain Focus, brought to you by Proactive Pain Solutions. Pediapain Pain Focus highlights pediatric pain information and provides tools and resources for all healthcare professionals taking care of children dealing with pain. Here's your host, Dr. Anjana Kundu.
Hello there, friends. Welcome to another episode of Pediapain Pain Focus. I'm your host, Dr. Anjana Kundu. And today, we are going to be talking about policy and how policy is important and influences the work that we do every day. Policies play a major role in promoting pain management, that is, provision of evidence-based medicine for reducing the amount of pain that someone experiences and how we manage them, how we ensure the safety, the quality, and such. Now, policy work makes most of us think that it perhaps involves something that happens at the Capitol Hill level for us in the United States and in the Parliament and other government agencies in other countries. And to some extent, it seems like it's something that's happening out there that we do not necessarily have a control or role in. However, my friends, after today's episode, you will change your mind if you did think that way. And if you didn't think that way, that's fantastic. You'll just get a lot of amazing pearls out of our today's guest's work. The truth is that true policy work starts at home. It's what we, that is you and me and each one of us, does each of the day as we go around providing care for our patients. It's what we do to ensure the safety, quality, and access to healthcare, or in our cases, the pain care. And my today's guest is Dr. Fiona Campbell, MD, FRCA. Dr. Campbell has done and continues to do a lot of work in each of these scenarios, that is, at the national level as well as in her day-to-day work. And today, she will share her experiences, her work, and her advice with all of us, you, my listeners. Just a little bit about Dr. Campbell. She is the professor at the University of Toronto and the medical director of chronic pain program in the Department of Anesthesia and Pain Medicine at the Hospital for Sick Children. She is the co-director of the Sick Kids Pain Center and the co-chair of the Ontario Chronic Pain Network in partnership with the Ministry of Health and Long-Term Care. Dr. Campbell also served as the president of the Canadian Pain Society and has also been appointed by the Health Canada as co-chair of the Canadian Pain Task Force. And in this role, she is helping drive the Canadian National Pain Strategy, which is a national strategy for pain for all Canadians of all ages, so children to adults to underserved populations and such. It is a really broad mandate that is established to influence the change that needs to occur in provision of good and safe quality pain care for all patients in Canada and hopefully all over the world. Dr. Campbell's contributions are immense. She has been working in this area for over 18 years and is involved in utilizing quality improvement methodology to improve pain outcomes for hospitalized children, which is how she credits her policy work to have started. She has also worked to identify risk factors involved in the transition from acute to chronic pain. And recently, she has won a Sick Kids Center for Innovation competition, giving her funding to develop an app for tracking chronic pain in children. But I'm not going to go on and on about her work. I want you to hear from the legend herself. So let's welcome Dr. Fiona Campbell. Dr. Campbell, welcome to Pedia Pain Focus. It's so wonderful to have you here.
Thank you so much for having me. It's a great honor. I'm a great fan of the work that you do.
Oh, thank you. And I can't do this work without wonderful and accomplished colleagues like you all over the world supporting this work. So thank you again. Dr. Campbell, before we jump into the meat of our conversation today around policy work, could you please tell the audience a little bit about yourself, a little bit about your background and how you got involved in pediatric pain medicine?
Well, it's a bit of a long and winding road, and it's a pleasure to talk about it because it's been an interesting, fascinating, and fun journey. I am completely passionate about preventing and minimizing pain in children and its impact. I actually did my undergrad degree at McMaster University in Canada, where I studied psychology, and I loved it, and I actually wanted to become a psychiatrist. But after training, I moved to London, UK, where I met my partner. And by serendipity, I started working in anesthesia. And then from there, I really discovered that there's a lot of psychology, both in my general anesthesia role and particularly in my pain practice. I love my pediatric anesthesia. I did a fellowship in Toronto. I returned to the UK, developed an interest in pain. And actually, my first job was as a pain anesthesiologist for adults. And then opportunity presented itself to move back to Toronto, where I'd done my fellowship, and to take a position as a pediatric chronic pain anesthesiologist. And I'm currently the director of the largest pediatric chronic pain program in Canada. And I still practice clinically in both anesthesia and chronic pain. So that's my route to where I am.
What an enriching journey right there. And it's interesting you talk about your interest in psychology and psychiatry, because it seems like, to me, it seems like you can't be a pain clinician without having an interest and engagement in the human psychology, because that's such a huge part of it. Despite your immense contribution to the field so far, one of the recent interests you've had is around the policy work in pediatric pain. So tell the audience, tell me a little bit about how did you get engaged in the policy work and what made you interested in going that route?
Yeah, so it's a gradual evolution in my career. And it really began locally and then provincially, which, provinces in Canada are a bit like states in the United States, and now nationally, and taking on various leadership positions along the way. And I've never given up my clinical base or my clinical practice, but it struck me that in getting involved in policy, whether it be small or big, is an opportunity to make a bigger difference to larger populations. And so I wanted to really do both, do the best by the child in front of me and the best by the population that really needs things improving. And so I have been very fortunate to work with people in positions of influence, whether it be at the hospital or the province or the federal government, who have helped this journey. And I would really just say to people, if this resonates with you, grab opportunities as they arise. pick people's brains and get involved, get stuck in. So I am still involved in improving pediatric pain outcomes at local, provincial, and national levels, and international, but less so. We know that pain in children is common and undertreated, and devastating impact on quality of life. We know it's an expensive problem for community. And we know that well-managed pain leads to faster recoveries, fewer complications, improved health-related quality of life, decreased use of resources, and enhanced patient and family satisfaction. So when I first arrived at Sick Kids, which is about 18 years ago, I'd been a consultant in the UK before. I sometimes jokingly refer to this move as a healthy midlife crisis. I was invited to chair the hospital's pain and sedation committee, where I became mindful that there was child and family dissatisfaction with the way that pain was being managed in the hospital from, surveys. They were called picker surveys back then, but things have evolved from there. And so what I wanted to do is really undertake a benchmark audit of the state of play in the hospital at the time with regard to pain practices and clinical pain outcomes, because I realized I wanted to have a baseline by which to be able to evaluate impact of policy and practice change. I guess it was a form of quality improvement, but without giving it a name back then. So I just referred to it as a benchmark audit, and it's been amazing for me to go back to that and observe trends over time. It's just broad bucket stuff, but it allows you to see the impact of some of the things that you've been able to implement. So following that, I became involved in developing evidence-informed guidelines just at a hospital level, and then mobilizing this knowledge to the hospital community to support practice change at the hospital. And it's really important to use a top-down and a bottom-up approach. That you need to be able to inform all the stakeholders across the organization, because we all have a responsibility in this. So I was very fortunate that the CEO of the hospital at the time, a woman by the name of Mary Jo Haddad, recognized that this was an important health issue for kids. And she really supported this and did some important messaging. So I'll try and give a few pearls as I go. And
Absolutely.
if you can get someone in leadership to support your message and put it out there, it will really help people buy in. All the while you're dealing with all of the inpatient units, sharing the results of your audit and providing feedback and so on and so forth. So that was my first foray. It was local. Through that work, the CEO recognized that I had some knowledge that could be maybe spread a little more widely. So an opportunity arose for me to take on a leadership role in the province. So in partnership with a senior medical advisor of our Ministry of Health, I became co-chair of the Pediatric Chronic Pain Network. And this allowed me to make a difference, I guess, across our province in terms of building capacity. We managed to make a claim, create a case for creating more pediatric chronic pain services. We fostered research and educational initiatives. We got funding to start some Project Echo. I don't know if you know about the Echoes, but we have a pediatric pain echo at the Hospital for Sick Children. And I also sat on 3 provincial quality standards committees involved in developing quality standards to inform pain practice. And then there have been the more recent national things I've been involved with.
This is extremely helpful because, when people think about policy work, they think like it has to be some big, grand adventure and a venture at like a national, international stage. But what you're obviously saying is you have to start at of course it may grow into that, but would you start as locally where you are? And that policies are affecting and happening. Policy work is happening at every level. So this is fantastic to hear because it's so relevant to all of us, right? It's nice to hear that you can start right where you are as local as your division to your institution, to your province, to your, country, and internationally as well, because you create that ripple of change.
Yeah.
And that just sort of grows from there.
And one of the things that I do want to add to this, because I know that you have people with lived experience and kids and families who listen to the podcast and are involved in the important work that you are doing, is to say that it's really critical that you have patients and people with lived experience involved in every step of the way of creating policy and practice guidelines, because nothing about us without us. If you don't have the end users of these guidelines and policies that you're involved in creating, then it's not going to be as meaningful or as rich as when you have the kids and families involved in co-creating such documents. So I just want to give a shout out for that, because I think that's really, really critical. Yeah.
Absolutely. And it's a bottom up and top down approach. So you've got to take all the stakeholders into it. So thank you for clarifying that. That's beautiful.
Lovely. Dr. Campbell, you started talking about the important pieces of policy work and one of the stakeholders as being the patients and families. But let me take it a step back and see, sometimes as clinicians, as healthcare professionals, which a lot of us in the audience are clinicians, of course, we fulfill all these other roles as well. But primarily as clinicians, you sometimes worry, I don't have enough time to just get through my day. How do you then embrace this kind of policy work? Because you've articulated it so beautifully that it is important. Like it's not happening out in a vacuum somewhere. This is part of the work, and it informs, as well as improves our work, right? So how do we reconcile those two separate chambers we've created about in our thinking about, like, those are two separate things?
Yeah, well, I think we have to stop thinking about these things as separate. I mean, we're paid to do our clinical work, and a lot of these other things go on off the side of our desks. But because they're important and they can influence the way you practice clinically, if you value it enough, you will do it. And I'm just thinking of the people who are likely listening to this are engaged. And so they will recognize, preaching to the converted, if you like. So people are doing this because they want to be better. And I think if you want to absorb knowledge and improve the way you do things, then we almost have an ethical responsibility to give back to that and take it to the next level. Because, I'm not going to be around forever, and we all have to give to this. And the more that people can contribute, the better we will do. Some famous philosopher once said, no one's going to go to their grave wishing that they had spent more time at the office. However, were I just to be a bum on a seat in the operating room, I think I would perhaps feel that way. But to feel that one has contributed in a bigger way to the societal issue of pain in children is very gratifying and fulfilling. And so you find the time and the way to do it. And they're not mutually exclusive. They're not separate buckets. I mean, you're in these leadership roles, even in your role as a clinician. You're an expert, you're an advocate, you're a mentor, you're an educator to kids and the professionals with whom you work. And so you're kind of doing it anyway. Why not extend it out to make it bigger and more powerful?
Absolutely. Absolutely. And, as they say, any policy should set the foundation for safe and cost-effective and efficient healthcare, right? So our goal is to provide safe care, cost-effective, efficient for all involved. So it is integral to how we operate in our day-to-day work. So I think you're right about that. What do you hope to achieve with doing the work that you're doing, Dr. Campbell?
Well, about a couple of years ago, I was in the fortunate position of having been invited by the Federal Minister of Health to co-chair the Canadian Pain Task Force. And so I'm really contributing to a movement towards a Canadian national pain strategy. That's my ultimate aim, so that we can have a national strategy for pain for all people living in Canada, adults and children. And of course, I have a particular vested interest in the pediatric, but it's really for all Canadians. And this has been very exciting work for me. It was a natural extension from some of the provincial work that I'd been doing. I had become president of the Canadian Pain Society, which is the Canadian chapter of the International Association for the Study of Pain. And I think in that role, I'd been recognized for some leadership work, and then the Federal Minister of Health appointed me into this position. So the context is that we know that 1 in 5 Canadians lives with chronic pain, including children, with devastating impact on health-related quality of life. It disproportionately affects vulnerable populations, including veterans, people from the Black, Indigenous, the BIPOC communities, women, and the elderly. And we now need to address 5 key findings. So the Canadian Pain Task Force was established to provide advice and information to guide government decision makers. So it's really getting involved in policy at a national level towards an improved approach to the prevention and management of chronic pain in Canada. And the task force is only 8 people, but it's comprised of people personally impacted by chronic pain, so people with lived experience, Indigenous people, researchers, educators, and health professionals with expertise across a variety of backgrounds. And we also have an external advisory panel, which provides additional subject matter expert, and we're supported by an extraordinary secretariat funded by Health Canada. So this is something that really has teeth now. We've published 2 reports for which I can send you links in case people are interested.
Lovely. Yes, that would be lovely. I'd love to include those in the show notes.
Yeah. So the first is really about the current state of chronic pain in Canada. And then the second report, and that was entitled Chronic Pain in Canada, Laying a Foundation for Action. But then we did our second report, and that involved national consultations broadly across from east to west, where we reviewed evidence to identify best practices and potential areas for action and elements of an improved approach. Really, we have just been in communication with the minister who's just endorsed a strengthened mandate to provide recommendations for policy change, to hold the government accountable, also an accelerated mandate. So instead of having till December, we have till the end of March. So this federal minister is quite inspired and is really excited about this.
Congratulations on accomplishing that. That's fantastic.
Yeah. So, this group of 8 of us have really led in this broad stakeholder consultation, national surveys, subspecialty workshops in various different domains, including Indigenous peoples, people in the research space, lots. And we really came out with 5 key pillars. And those are that these are the recommendations for action that we're now working on. That we need access to timely and patient-centered care. The second is that we need to increase awareness, education, and specialized training for pain. We need to invest in pain research and related infrastructure. And we need a way to monitor population health and health systems quality. And we need to really pay attention to populations disproportionately impacted by pain, including Indigenous peoples. So those are the 5 pillars for which we've been charged to identify policy. And these policy levers can be in the health space, in social policy, and economic policy. So we've really got a broad mandate to begin to influence change.
Excellent.
So,
and you said, sorry, go on.
No, go ahead.
No, I was just going to ask you, where does pediatric fall into it? Does it get the equal footing that it gets across all the domains, or do you also delegate it to more of the fifth domain, which is the disproportionately affected populations, like the indigenous populations or the elderly or
Yes.
extremes of ages?
It's integrated throughout the report. So we know that kids do not have access to timely and patient-centered pain care. We know that pediatricians don't have the knowledge, skill, and judgment, or people in primary care don't have the knowledge, skill, and judgment to prevent and treat pain effectively. We know that specialist pain services are few and far between. We know that there is great lack of awareness that kids even experience chronic pain. And we know that education, specialized training in pain is even more problematic for children. So these things are highlighted throughout the report. And we have several very influential people who are involved from the pediatric pain space in Canada, several of which have been involved in podcasts of yours and so on. So Christine Chambers is on the advisory panel. And so we have some really terrific people involved in this work.
That gives me so much hope and so much joy I can't even express, because I feel like even being your neighbor and, equally large country, we feel like children here on this side of the border don't get that kind of same consideration that they have gotten, especially when it comes to pain, that they've gotten in Canada. And it is very hopeful to see that happening next door, so that hopefully we here can benefit from that as well. And hopefully it'll help our efforts as well.
Well, I hope so. And we are really, truly blessed in Canada by having incredible pediatric pain researchers. So we've got pockets of great scientists across the country. So the research component of the task force's report really give a shout out to that, because, from pain, basic science through to knowledge mobilization and some of the pediatric pain networks, Solutions for Kids in Pain called which I can also send to you as a resource, because I think it really is a great example of a national coordinated knowledge mobilization strategy that people in the US should be able to, the sorts of knowledge that's out there is relevant globally.
Yes.
It's not something that's just unique to Canada. So.
That is true. And, like I said, it's always been great to associate with colleagues like you. And as you're mentioning, the work that's been done by our Canadian colleagues has been immense and has been a great example for the pediatric pain world across the globe. And the reason why I've had so many wonderful Canadian colleagues on this podcast to share their knowledge, because of course we want to make this accessible and available. As you said, access is an issue and knowledge dissemination. And, you're mentioning SKIP, which is such a great initiative. And my company, Proactive Pain Solutions, has been a partner with SKIP right from the beginning. We were involved in giving a letter of support, as well as at that time, I was serving as the president for Society for Pediatric Pain Medicine here in the US. So the SPPM also partnered with SKIP. So we definitely have been holding on to the coattails of all the amazing work that's been getting done there, so that patients and families and clinicians and researchers across the globe can benefit from that, and that we can amplify our efforts together.
Exactly.
So, this has been great, that your journey and evolution into this work is absolutely very inspiring and lovely to see. But I can also think of people that are mostly involved in clinical care or are just starting out in their career in this path, and just wonder, where do I even get started? How do I get involved in doing some of this work? I think one of the things you mentioned was finding a sort of a local leader, if you can, or somebody with a voice within your institution. If you can give some pointers to if somebody wants to get involved, and then how would you recommend someone get started?
Well, first of all, I'd say that people need some experience. They definitely need passion and a real interest, an authentic interest in improving the way things are done. And if you have those things, which I suspect is many of the listeners, you can get involved. There are opportunities for formal training in health policy, which I did not do, but I suspect would be very helpful for people who have a focused interest in this area. And I don't have specific resources for that. I would say start low.
And they probably vary by where you are as well.
By jurisdiction, for sure, yeah. I would say people need to start low and go slow. You can't do everything by yourself. Surround yourself by like-minded people, including kids and families. Make this interprofessional and get people already involved in leadership positions and in policy around your organization. And probably just begin in your local hospital. Find influencers and leaders who share your interest. Bounce ideas around. And get involved and see what is happening in your local, regional, and national jurisdictions. Talk to MPs where you see gaps in access to care. Help create movement towards action to improving pain for kids. But it doesn't just have to be local. There are great people around the globe. There's a strategy in Australia, there's strategy in the US, emerging strategy in Canada. Talk to people, don't reinvent the wheel, and don't be shy. People love to be asked for help. Right? Love to be able to provide tidbits of knowledge, their pearls of wisdom, whether it be big strategy or small little pieces of it. And those, I think, are the important things that you can do to get involved. But you may have to reach out yourself to begin with. Don't wait for people to come to you. And people will be very grateful to have you there expressing this interest. If you don't have a pain committee in your hospital or organization or clinic, maybe get one started. See if a few other people are interested in getting involved. Benchmark the way you do things right now and see if there's little bits of small change that you can implement, whether it be around pain assessment or standardizing treatment. You know, we've got to reduce the variability in the way we do things. And you can look to international organizations such as Childkind for recommendations on policies and quality improvement and things to do, very focused on pediatric pain. Use those as a starting point to help ground you and just reach out to people to help. That's what I would say.
Great. So, Dr. Campbell, let me ask you, often people will say, I'm just a worker bee, I'm a clinician. How do I engage the decision makers within my institution, for example? Do you have any tips that people, especially those starting out in the earlier stages of their career, how do you make your opinion or your voice heard? How do you get engagement from somebody who can actually give some weight to your efforts?
Well, if I think back to the way that I got started in this, it was the voice of patient satisfaction or lack thereof with the way their pain was being prevented and treated. And if you can do satisfaction surveys and find that the way things are being done is leading to dissatisfaction amongst patients, especially with the drive now in the developed world, certainly towards improving quality, you can make a case that things are not as they should be, then you will get support from people in your organization. They will want this to be driven up. You can't argue against that. So that's probably where I would start.
Yeah, that's fantastic. And, I had a colleague who he would actually take a self-created little form or something that the hospital might have been using with patients and families, and he would just take on the rounds. And especially if somebody was expressing that, how his care or the team's care influenced their life positively, he would make sure that they get a little form and say, will you just fill this and send it to the administration, and they would have the envelope and everything. And that I thought was phenomenal. And I thought that was such a great way to get started. Of course, we all want to feel great about the work that we do and want the accolades. But what he was really doing, it wasn't so much about your self-accolades, but it was just amplifying the work that was being done by the pain service, the pain team, pain treatment service. He was just making sure that stayed front and center of the administration, that they kept hearing those little messages from patients and families. Especially pain management can be such a small little blip on the administration radar, especially when it comes to pediatric pain. Although I never understood why that is the case, because it impacts every aspect of the clinical care. But it does.
I was just going to say that pain is often a byproduct of why people come to hospital. So if it is not the priority for the service, you come in with abdominal pain and your appendix is responsible for that. You have your appendix removed. It's the appendix is why you're in the hospital. You're not in the hospital for the pain. So it's kind of this byproduct. And I think that's why it doesn't have the priority amongst some of the healthcare professionals in the treating teams.
True. Because like you just said, we still think of pain as byproduct of something that we, of course, we preaching to the choir all know, yes, it could be that. However, pain is, an entity and a disease in itself and deserves a little more attention than it has been. And the way we can wait is what I'm hearing you say, Dr. Campbell, for others to just recognize and put this on pedestal for us. We have to be the ones to move this. And if needed, create a pedestal.
Yeah, so, exactly.
Thank you for doing this amazing work that you are doing. Well, you've sort of, throughout the interview, sprinkled these nuggets of wisdom and advice, but would you summarize your advice to pediatric pain professionals? What would you advise them?
I think firstly, you need to look after yourself. You need to exercise, sleep, pay attention to your diet, pay great attention to your mental health, do things you enjoy, perhaps practice mindfulness and have a good social network. Be authentic and passionate and think about what you want to pursue in the 3 pillars of what we do in medicine. So clinical, research, and education. See if these can extend into policy. Clinically, believe your patients and make informed decisions that will ensure that you do the right thing for each child in front of you, and by extension, get that to inform your policies and practice guidelines, and focus on things that bring you joy personally and professionally. It's been incredibly rewarding.
Absolutely. Well, thank you. Amen. That was beautiful. And Dr. Campbell, how do people get hold of you? How do they get in touch with you? Fiona.Campbell@sickkids.ca. There's 2 Ks in the middle of Sick Kids. I know it's a funny sort of name. We should be Health Kids, but it's really become a brand now. And we have a Pain Center website through Skip. Lovely. What do you do? You said take care of yourself. So what do you do for self-care? What do you want to recommend?
Okay. Well, I mean, just as a person, I am quite busy, obviously. I have my professional work, which is extremely busy. I have 5 kids. I wanted 4, but had twins on the 4th pregnancy. And
Oh, wow.
they were all, they're young adults now, but they're all when my twins were born, my eldest child was 5. So I had 5 kids, 5 and under. So my life was extremely busy and still is, and brings me great joy. So getting them involved in all of their activities and sticking by them. I exercise, I ride my bike to work. My threshold for not riding my bike to work is that if it's below minus 10 degrees, that's centigrade, not Fahrenheit, then I will ride my bike to work unless it's icy or snowy. I play competitive tennis and squash. I try and eat well and sleep well. I practice mindfulness, and I have a fantastic network of friends and colleagues. So I'm blessed. I am blessed. And I have a wonderful partner. So.
Oh, that's fantastic. That's great.
I'm a normal human.
Right? Yes.
Well, pretty normal human being. Yeah.
You are. You are more than normal. You're super.
Oh, no.
With 5 children, building such a successful career. This is even more inspirational. I'm finding more and more about you. I've always admired your work and looked up to you. And of course, that's been amplified even more. So it's been lovely to see. And somebody who only has 1 child and was overwhelmed by just having 1 child, absolutely have great respect for you with 5 children, Christine with 4 or 5 children, and such amazing career and legacy that you are leaving for better care of children in pain. So it's an honor to have you on here, and honor to just know you and be your colleagues.
I would, right back at you. Thank you so much for all that you do, and really spreading this knowledge through your network and your podcast and your website. I think it's really phenomenal. I think we have a fantastic international global community in pediatric pain, and it's great that we look after each other and like each other.
Amen. Thank you so much. Thank you for being here and taking the time to share your expertise.
It's my very great pleasure. Thank you.
There you have it. Wasn't that just incredible? Wasn't she full of such down to earth, yet such important pieces of advice? She's so motivational and such an inspiration to help us all strive better in our work, our day-to-day work, as well as achieve higher standards in our work that we do every day to make a change in these children's lives. I hope you will take some of these elements and implement in your practice right away. And I'd love to hear from you. What is it that spoke to you most importantly? To me, it was just the simplicity she placed around the policy and the important work that she is doing. That it all starts with you, with the work that you do every moment in your role as a pediatric pain physician. So I certainly will have a different lens looking at the work that I do every day. I'd love to hear from you. You let me know, what elements are you going to implement in your practice? How has her discussion today changed your perspective on how you see policy work? And if you haven't already, please make sure you subscribe to our podcast so that you don't miss any of these incredible guests we have or the amazing topics that we discuss all the time. Also, please make sure that you take a moment to review our podcast so that it can get in front of other people who could use this even more so than you need to. Like always, I'm so grateful to have you my listeners supporting this work, giving me motivation to keep going, and suggesting the topics that you want to listen. So continue to do that. Make sure you leave me comments about this episode and or any other topics that you may want to hear. And I will be back in 1 week's time with another incredible speaker, Dr. Tracy Harrison from the Mayo Clinic. So join me next week, won't you? Until then, stay safe, be proactive. Bye now. Pedia Pain Focus is a presentation of Proactive Pain Solutions, a company committed to transforming pediatric pain care through improved access, quality, and expertise. Did you know that there are only 4 accredited pediatric pain medicine training programs in the US? Meanwhile, there are 19 million children that suffer from chronic pain. This means the children's pain care is largely left in the hands of untrained healthcare professionals. This large gap in children's pain care leaves both the healthcare professionals as well as patients and families frustrated. Data clearly shows that untreated or poorly treated pain in children leads to a much higher incidence of refractory chronic pain that lasts into adulthood, much higher incidence of mental health diagnoses, and a massive societal burden. It also leads to poor job satisfaction and poor job security for healthcare professionals. Proactive Pain Solutions Physicians Academy is the answer to this major problem, eliminating that large gap through our comprehensive evidence-based virtual training program that's bolstered by live Q&A sessions, personalized mentorship, and leadership development. The limited time enrollment is now open and it offers a limited number of spots. So join our academy today and know what it's like to have the expertise at your fingertips while you enjoy the professional satisfaction and the job security that you deserve. Join us at www.proactivepainsolutions.com.